my head to one side.
Yeah, we can see it.
So this project is essentially what it says on the tin, and we are looking at place-based interventions for health and well-being inequalities for Roma people aged 40 plus. You can see there sort of in bottom strapline all of the people who are involved in this. This is yet another UKRI project, and it was really quite strange because we actually got funded for both the projects, the one I'm PI on, I'm speaking about, and this one which I'm CI on, and where I'm working with the team. This is the third time we attempted to get this funding, so I think the message of this is never give up. We've been shortlisted for the MRC before and ESRC before, tweaked it for this particular call, and on this occasion we were successful. One of the reasons that we have gone for 40 plus, and this really does speak to all of the background literature about Roma health exclusion, is that Roma people generally regard 40 as being of older age, and you may or may not be aware about the general shorter life expectancy within this population. So I'm going to move to the next slide because I can't remember what's on it. I'm going to go back actually and give you a bit of a summary in that case. Apologies, because I'm not so familiar with this slide set. So one of the things we know is Roma people experience significantly worse health outcomes, increased rates of morbidity and mortality across the life course right across Europe. And in fact, we know it's slightly less bad where Roma populations live in Latin America, interestingly. So I've worked with some colleagues there. Roma communities, we are using in term here of people who are more recent migrants out of the collapsed acronym of Gypsy, Roma, Traveller. So Romani Gypsies and Roma have the same heritage, come from India as roots, they still share certain elements of language. Roma people by and large have become, moved across to Western Europe as part of EU accession, and prior to that there were also numbers of people who claimed asylum. So Roma are found virtually throughout Europe, and wherever they're found they tend to have a shorter life expectancy, a great deal of exclusion, typically worse educational outcomes, and just generally do unfortunately very badly on many domains of social determinants of health. It varies obviously across many countries, and one of the things that's come out from this work and other work I've done and colleagues have done in the past is Roma people in the UK, despite still experiencing exclusion, say that by and large the experience here is much, much, much better than many other countries, both country of origin or in other parts of Europe, because they do experience significant levels of discrimination and hate crime, for example. The EU have got enormous suites of work around working to support Roma people, and there's 4 key strands within that. So Roma mitigation strategy, which first came out in 2006, I believe, was first iteration, and have which been updated continually. We are seeing some improvements, but not as great as one might hope. And the 4 key strands within that are looking at education, accommodation, health and general social inclusion. There's also work going on at the moment with the ONS, and I'm sort of involved in that on the advisory board, and also we've now managed to get some of the Roma Place Age team involved as well in that work with the ONS to explore what's going on for Roma populations within the UK, because by and large we don't know a huge amount. There's smaller projects, there's quite bitty projects, but there really hasn't been anything really substantial. The other issue is because Roma are found in so many countries, you've got the overlay of not only being Roma, but being Czech or Slovak or Romanian Roma or Ukrainian Roma, who of course are asylum seekers if they come from Ukraine, sort of Bulgarian Roma. So you've also got faith dimensions. So for example, Bulgarian, Turkish Roma, Muslim, many other Roma from other parts of Europe will be Christian as well. And then there's a growing number of evangelical Christian groups as well who are integrated with Roma. So one of my former PhD students was looking at Pentecostalism in Croatia amongst Roma populations. So it's a very, very, very complex picture. No one size fits all, although we do obviously have certain things we know about all of the populations, one of which is lower life expectancy and generally, poor health setting at an earlier stage. We also know people generally have larger families as well, and often, but clearly not always, they're lower educational standards and attainment. In many countries in Europe, despite lots of court cases, there's still integrated education. This has been condemned repeatedly in Europe, particularly Czech, Slovakia, Hungary, there's issues too. So this project has been completely co-designed, and you'll see there that we have Community Renewal who in Glasgow. We also have colleagues at Luton Roma Trust, and within Peterborough we have Compass, who so groups that we know really, really well and have worked with. Sasho, who is postdoctoral research fellow, is himself Bulgarian Roma and is one of the very few Roma people in the UK who have got PhD. And I think between us, myself and others in the team, we probably think we know everyone who's got a PhD with it from that community. Okay, brief summary, on to what are we doing and why are we doing it? So healthy ageing, I'm not a specialist in ageing in place, I have to say. And Ryan, who's the PI on this, who's based up at Heriot Watt, he is a specialist in ageing. He had not worked with Roma communities before, but it became a bit of a marriage made in heaven when we had first all met and started joining the dots. And one of the things he says is that research on ageing overwhelmingly takes a sort of deficit approach. It focuses on needs, dependency, vulnerabilities, and miss the bigger picture. We add to this the deficit approach quite often to looking at Roma experiences or very, very narrow focus, as in Roma childbearing, Roma access to vaccinations, for example. And we've created a very different approach. So it's place-based and it's asset-based. And what we are looking at are physical, social and cultural resources that enable Roma people to age healthily in place. And what's important is because of the fact we're looking at a relatively recent and constrained migrant population, we still don't know how many Roma there are in the UK. And one of the issues about this is until June, Roma were not included in the NHS data dictionary at all. And we've all been banging on about this for many, many years, but now thankfully that's changed. Similarly, they were the first time included in the census in 2021. So again, a lot of people, because of fear, concerns about discrimination, do not self-identify, but we're beginning to start to build up a picture. And so the way of working inevitably is very much full co-production with communities. Best guesstimates in terms of size of population, and this does not appear at all in census data, which is a gross underrepresentation, is we think there's probably about 300,000 to 400,000 Roma people living across the UK. And one of the groups, for example, you might have seen about the riots and racism that happened in Northern Ireland, Roma people were particularly targeted. And again, it was one of the things which is horrible but interesting, we see it all over, is people often collapse categories of Roma and Romanian, assuming all Romanian people are Roma, all Roma people are Romanian. So it's really difficult to untangle that quite often. So Roma people were targeted. We know a lot of people at that point have fled Northern Ireland, some of whom have come to the UK, some have returned to country of origin. But that's just to give you a snapshot of some of the issues that are going on. So what we're looking at in this fully co-produced study is, how can people begin to age well? Because we're starting to see older Roma at last, because you've got people who've either joined younger family members who are here, or maybe came 20 years ago. And if someone came, the healthy migrant effect, and arrived in their mid-20s, they're now in their mid-40s, given we know that people age at different rates and often have a lot of pre-existing health conditions, which come from lack of access to healthcare. 20 odd years ago, I did some work for the Fundamental Rights Agency in Europe, and one of the key groups we looked at were Roma, and we found something in the region of 40% of Roma populations had no access to health insurance and therefore did not actually have preventative healthcare. So what we've got a group of people, it's really quite a unique study group, apart from the fact obviously many people have got skin in the game who are involved with this project and who are from populations. So we're going to try and hopefully shine a spotlight on the experiences of these populations in our three areas of Luton, Peterborough and Glasgow. Okay, so I mentioned it's funded in the same funding stream as MIGREF Health. So it started in February 24, it ends in February 27. And as with the other project, here we are right at the midpoint now. So we've got to do the review, collect all data and submit by the 5th of September. And I've mentioned already the partners who are involved in this, two of which are in our study areas. We've taken a community-based participatory research approach, and so as again with MIGREF Health, people have been trained up as co-researchers, in this case who are members of the Roma population. And so we have people who are trained who are Czech Roma, Slovak Roma, Bulgarian Roma predominantly. Trying to think if we've got other populations. I think they're the main groups, and it varies. So for example, in Luton, we know that's predominantly Romanian Roma. In Compass, we're mainly looking at Czech and Slovak Roma, because people often will coalesce around a particular community, culture, language, kinship groups in particular localities as well. So that's why it's important we can match across community co-researchers and the projects who've got deep reach into those groups. So this is what we're setting out to do, to identify how Roma communities experience healthy ageing in place in mid to later life, to establish those priorities for how we can address health disparities. And as I've said, these are not a small population. They're a largely invisible population, but they are not small in numbers, just because, we don't have the data. To start to co-design integrated place-based interventions to reduce health inequalities. Alongside that, we're building research and impact capacity, and that's through our collaboration with the Roma civil society, all the people that we're training up to be interviewers, and Sasha and Ryan have largely, led on the training. I've got to say I've been involved in some of it, but I have a more fractional role in this because of other projects. Working with voluntary and community sector, policymaker and practitioners, and hence it's really important to have that level of engagement with ICBs and local authorities. So this is, how it looks in terms of the different landscapes. To WP1, as I said, that there's not a huge amount of data out there on Roma communities in the UK. It's more sort of particular locality based, and we've got particular projects working on one theme. For example, it might be access to education for Roma youth, but generally there's not much at all going on about older people. I'm trying to remember when it was, I think it was 2014, WHO, we were all, a number of us who worked Roma in Pej in Hungary, near the Croatian border, medical school there, which is a Roma health reporting centre. And there was a declaration on healthy ageing for Roma, because those of us who were involved were signatories to that. But not a huge amount has gone on since then, which is why it's so important to be doing this project. So mapping a landscape, then going through the community co-production in terms of looking at what sort of questions we want to ask, and starting the walking interviews, where we ask people to look at, where they feel safe, where they don't feel safe, where they might gather, where they're included or excluded from different localities, how they understand about what services they can access and what services they choose to access. And that's that lived experience, which has been gathered by our trained community co-researchers. Work package 3, we've not got there yet, but we're going to start soon, is thinking about place-based hubs. And that's where we're going to be working with ICBs, local authorities, and a range of stakeholders. And then work package 4, obviously pathway to implementation, and then knowledge exchange. So we've got a lot to do in the next 18 months. Few photographs from training activities and things that we've been doing here. And Ryan, there we go. Oh, I'm not in that photo. But if you look at the top on the left, that's Ryan. Then you've got Sasha. Then we've got Marika. Then we've got our colleague Krina from Luton Roma Trust. And I've gone blank, I'm afraid, on the names of the other two community co-researchers. But you can see here other activities in different locations, including Peterborough and Glasgow. I don't get up to Glasgow, it's rather too far for me, I'm afraid, and I've got caring responsibilities, so I hang out around sort of Peterborough and Luton. These are some of the ways we've been gathering data. So you can see here we've done things like cafes and getting people to start talking about activities, and you see here these are translated, obviously working with people with translators. Some people have English, others don't. Shorthand, thinking about planning for pensions. Many people have got no idea about pensions. Countries of origin would have been supported by relatives, for example, rather than actually sort of having a more formal pension, often working in, very fragile type economic situations too. So there's a lot of that. Lack of Romani's interpreters. This is a really important one, and this really is much the same for, our work with refugees, asylum seekers, and all projects I've done with Roma populations, is that someone might actually go, we'll find you a translator. But if they find, say, a Czech translator or Romanian translator, they're still not talking Romanis often. And because of that, you're then going to 2 or 3 iterations, so it can lead to real understanding. And frankly, I have to say as well that some translators also do bring prejudices with them from countries of origin. And certainly, we've seen this at times, or where there's been someone who, does speak Romanis who go, actually, that wasn't what was said. That's the wrong interpretation. So it's something to really, be alert to. So you can see here some of the images of the activities. So what are these barriers? These are the things that are emerging. Healthy aging is compromised by lifelong disadvantage. I think I've talked about that a lot. Housing often inadequate and unsafe, particularly for people who've got disabilities. Many are living in very poor quality private rentals, often have zero understanding of what rights you have to adequate housing, or scared that will be evicted. Certainly not in this project. In other projects, I've gone to visit Roma families and I've sort of nearly broken my ankle by stepping on sort of like dodgy floorboards in houses that have got damp and things, and people can often be really quite overcrowded, because if grandma has come from Cheshire to help support childcare, you're going to put granny who doesn't have English in with the family, who might already have 4 or 5 children, and maybe there's some uncles and people living there. The everyday environments, as I said, they're not age friendly. I think that's the same for, many older people or aging people. But also we have this thing about outdoor environments and not for us. People would have outdoor space use in countries of origin, but feel very uncomfortable often. So we went out, for example, in one of the field sites, I can't remember if it was Luton or Peterborough, I think it was Luton, and we went to a local park, walking with Roma people and our community interviewers who are trained. And it was just like actually watching what was going on, really, with the walking interview as a trial interview before people went off and did their own. And one of the things came up was we had a Roma interviewee who was a family member of one of the other interviewers. So we actually, we were careful what we were doing to monitor and check for quality. And they talked about experiencing verbal abuse in that park, being because of the fact they were obviously Roma or how they were dressed, for example. So it's those sort of issues. So in fact, again, I see those similarities that in some sites that are unfriendly, a lady wearing hijab might experience abuse. And we'll see that sort of thing with Roma people who, won't, unless they are Muslim, be wearing hijab, but because they're wearing quite often very visible clothes, particularly the women, can experience that level of abuse. A lot of really limited opportunities for social participation, and other than within the community or within the immediate family. Also, if people don't drive, maybe, they've got disabilities that make it difficult to get out. There isn't those places that they'd have in a country of origin to get together with other older Roma people. So we said there's a lot of bonding capital, but not much bridging other than going into particular community groups. Income insecurity, financial well-being, barriers to employment, work, languages, concerns about pension or lack of awareness. Stigma, mental health is just not really spoken about, right? And I think you're going to find this a lot. It's increasingly being spoken about amongst Gypsy and traveller communities, but Roma people just don't, and older people particularly, as that sense, you can be judged, really, don't talk about this. Again, women, gender barriers, and I've spoken about clothing and how, someone might become very visible and therefore experience abuse. But also people are often unpaid carers. It might be grandchildren, it might be a partner, it might even be an adult child who's got disabilities that they're helping with, as well as grandchildren simultaneously. So if you think of all of that sort of thing about being sandwich generation, the sort of women of my age and, and younger actually, because my parents are no longer with us anymore. My kids are now left home, but that sort of generation, but you think of it multiplied many, many times, and also being constrained within particular localities often as well, plus language barriers. So you see there's a lot of similarities with some other minoritized communities. Older men, and again, almost no surprises here about guys not talking about health.
Sorry,
I'm out of time, am I? I can flick through.
A little bit.
Okay,
it's okay.
I'll just flick through. Okay, so
that's fine.
All the obvious things we'd expect about, interpretation, language barriers, relying on younger family members, really problematic. Talking about health, mistrust of services because of experiences of discrimination. Community navigators are good. We need more steroid exclusive places. Health education about Roma identity and intergenerational support. There we go. That's me.